Hello, and welcome to Verbling. Hello, hello. I am teacher Oakley, and today I will be talking to you about healthcare. We'll do a little bit of everything today. This is sort of a beginner, intermediate, advanced class, a little something for everyone. We'll cover some basic vocabulary we use when we go to the doctors. Then maybe we'll have a little role play, basic conversation that you might have if you go to the doctors in an English-speaking country. And then perhaps we'll have some discussion about healthcare. Healthcare, very controversial in most countries, I think. Too expensive, inadequate healthcare, lots of possible problems, lots of possible, really sometimes even disturbing things that we can talk about. Healthcare also, since, you know, Verbling, we're all so international here. One thing I've noticed in my travels, healthcare, the quality of healthcare, government programs that deal with healthcare, private versus personal insurance, very, very different in different countries, very different attitudes, very different policies, government policies, and even individual perception of how healthcare should be done. So in the latter half of the class, I'd like to get into some serious discussion about these controversial topics. So, come on in and join me. Always a good idea, if you want to make sure you get into the class, to get your reservations so that you can make sure that you can get in, because oftentimes there are many, many, many more viewers than there are spots. So, any second now, the button's going to turn green and jump on board. And we'll start our discussion. I'll start asking you questions about health. And we're going to start with vocabulary, very simple, get progressively a little more complicated, talking about healthcare and the doctor. Okay, we got a couple people in here. Hello, Iman. How are you?
Hello. Hello, good morning.
Good morning. Oh, I guess it's morning where you are. Where are you? Where are you, Iman?
I'm in Spain.
In Spain. Okay.
Yes, I'm living in Valencia, in Spain.
Oh, all right. It's morning time there, huh?
Yeah, it is. It's morning now. It's not morning time now there in... Where are you?
Well, I'm an American, but I'm in the Philippines right now.
In the Philippines is night time now.
Well, late afternoon. It's 4 in the afternoon.
Oh,
yeah. Okay.
Right.
Okay, people are starting to join the class today. I'm going to jump right into a little opening topic. Have you ever, let's see, let's talk to Arkady? Is that right?
Yes, you're right, Arkady.
Arkady.
Yes.
Wow, that's kind of like, have you ever heard of Arcadia?
Yes, yes, it's named from Greece.
Yeah, right. Interesting. That's a very interesting name. That's cool.
Thank you.
You know, my name is Oakley, so I like cool names.
Yes, it's my first time in your class, teacher Oakley, but I saw maybe 2 your lessons.
Oh,
it was really interesting.
Okay, well, welcome to the class. Have you ever had any serious medical problems where you had to go to the hospital or the doctor, like broken
when I
bone?
was a little boy, When I was maybe 1 year old, I've got a serious problems. I've got an illness that is dangerous only for babies, but not dangerous for older people. So I can die in that time, but I still alive.
Clearly, you survived. Quite obviously.
Yes.
Okay. Well, now I'm extra happy to have you in the class today. Okay.
Thank you, teacher.
Great. Well, I'm glad to see you. Yeah, you probably don't remember though, because you were quite young. Do you have any memory of that?
No,
Do you
no
remember?
memories. No.
That's very, very young, of course. All right, I'm going to say hi to other people and ask them a little bit about that. Christopher, hello.
Hi,
How are you?
fine, and you?
Yeah, doing well, thank you. And where are you from, Christopher?
I'm Chilean.
Chilean. Oh, okay.
Yeah.
Very good. All right, our topic today is healthcare. We're going to look at a lot of things, but have you ever had a healthcare problem where you had to go, for example, to the emergency room, like a broken bone or a severe cut or wound? Have you ever had anything like that happen, Christopher?
Sorry.
Have you ever had a Have you ever had
I
a
have in other world.
You're in another world?
Yes.
Okay. All right. Well, I hope it's not a medical problem. Anyway,
Yes.
well, that's our...
It's 5 o'clock.
Oh, you're sleepy? Do you guys... Okay. Here's a strange... We're going to do a bit with medical terms. I'm typing in a word in the chat box. Does anybody know this word? Insomnia? Does anybody? Yeah.
Yes, I know
Yeah.
it.
You know it. Do you have it, Frank?
Sometimes.
Really?
Hi. By the way, hi, teacher. Nice
By
to
the
see
way,
you.
hi, Frank. Good to see you. Yeah, suffering from insomnia is a horrible thing, actually. It makes you crazy. What is insomnia, Frank?
When you can't sleep.
Yeah, exactly. Insomnia is when you can't sleep. So, Christopher, do you have insomnia?
Yes, but sometimes I have hypersomnia. I sleep all day.
Ah, okay.
It's a change of sleep really. I sleep in day and I am awake in the night.
Okay. Well, I think that's a medical condition that we call vampirism.
Vampires.
I think that's a
Yeah.
medical condition. I don't know. Actually, there is a related word, and kind of a neat word, narcoleptic. And actually, this is a very
Yeah.
serious, it's not even, I shouldn't even joke. It's actually a very serious condition where people just suddenly fall asleep. I mean, very suddenly. They have to wear a helmet and pads, elbow pads and knee pads, because they can be severely hurt. Very
But
rare.
it's in any place,
They can,
in any moment.
any moment. They can't drive a car.
It's terrible.
Yeah, it is terrible. Can you imagine if you would fall asleep any time? I mean, what kind of a dating life would you have? How could you go out with a girl if you're going to fall asleep in your soup? Fall asleep with your face in the spaghetti. Horrible, actually.
Yes.
Yeah. Okay, I'm going to talk to a few other folks here. Emmanuel, are you there? Emmanuel?
Yes, I am.
Very good. And you have a
Yes, I am.
microphone. Emmanuel, have you ever been severely hurt, like on your skateboard?
Yes. When I was 16 years old, I broke up my arm.
Okay, I broke my arm. You don't need up. I broke my arm.
Yes, I broke my arm.
Ah, okay.
Okay.
And
Broke my arm.
okay, and did you have to have a cast? Did you need a cast?
Did you? Yes.
They put
Yes,
that
I need.
they put that thing on your arm to, you know, the plaster when they wrap around and around. You needed a cast.
Yes. See, yes. I put it.
Okay. How long did you have a cast for?
For 3 months.
For 3 months. Ooh, a good long one.
1 month or. Yes.
Okay.
Um.
Yeah. How did you break your arm?
Practice skateboarding in a bowl. In a bowl.
In a bowl. Ah.
Yes.
Okay.
In a bowl.
In a big cement bowl. Okay.
Yes.
I guess
Oh,
a bowl. Was it a skateboard park, Emmanuel?
Yes, in a
Okay.
skateboard park.
Well, there you go. There you go. In a skateboard park, the big bowls where you can, you know, spin and. I guessed it. I'm so proud of myself. Aha. Okay. Where is Iman?
I am here. I'm
I am-
typing. I
Okay.
was just looking for an article about this fly that is called SEC. It's talking about the narcolepsy that you were talking before.
Oh, really? Okay.
Yeah, it just you fall asleep if this fly
From
bites you.
the tsetse
Yeah,
fly.
you fall asleep. You get the kind of narcolepsy.
Really? Okay.
Yeah.
Interesting.
Yeah, when I was a child, my grandmother used to talk about it, and now when you were talking about narcolepsy, I went on Google to look for the, for the name of that
Uh-huh.
fly and just look for the information, and you can fall asleep.
Okay, you can get okay. Excellent. One of the
Okay.
symptoms. Oh, let's see if I can spell this. Symptoms of a tsetse fly bite or the disease you get from a tsetse fly may be narcolepsy.
Yes.
Symptoms are okay. You go to the doctor and he will ask, "What are your symptoms? What is bothering you?" "Oh, doctor, I have a headache. I have a high temperature. I'm feeling nausea." Do you know what nausea is? Oh, another hard one to spell. It's in my list, actually. Hang on.
yeah,
Hang on. I always misspell this word. Okay. Nausea. Sort of a
Yeah.
strange pronunciation, too. Nausea. If you feel nausea or you're nauseous, is the adjective form. Nausea is the
Well-
noun form.
When you feel as if you are going to vomit.
Exactly, Frank. You feel like you're going to vomit. And you all know vomit, right? Would anyone like to volunteer to demonstrate? Please don't. That's a joke only. Please do not vomit. Okay? No, we'll have none of that. All right. Because when people, have you ever noticed when someone vomits or throws up, it makes everyone else start to vomit and throw up. I think that's the last thing I need to happen in my verbling class. Have all the students, blah. That would be horrible. Really bad. Really bad. So, okay, vomiting, that might be a symptom. I have a cough. I have a sore throat. Actually, let's try a really quick exercise. English is weird. I think you're all learning English. I think you all know that by now. English is a strange language that is not always logical. An example of that is ache and sore. Okay? Very strangely, if we're describing symptoms, sometimes we use the word ache and sometimes we use sore. Okay.
That
So
is me. Pain. Pain.
pain. That's Sadat. Well, hi Sadat. By the way, hello.
I know.
Hi.
I know.
How are you?
I am fine. And you?
Okay. And very, yes, it means pain, but for some strange reason in English, depends on what hurts. If we use the word ache, yes, thank you, Christopher. That's ache, or we use the word sore, because it can be different. So, Sadat, if I have pain in my head, I have a
headache.
headache. Christopher got it. But how about if I have a pain in my throat?
Throat.
Yeah.
Throat.
Throat here.
Sore throat. I
Very
have a
good.
sore throat.
You're right. You're absolutely correct. At that time, you have a sore throat. But stomach, Christopher, stomach sore, not really.
Exist?
Yeah, that's gonna be that's right. That's gonna be a stomach ache.
Okay.
It's very odd. I can't really express to you what are the rules or when is it sore, when is it ache. It makes no sense to me either. I mean, if your eyes are painful, you have sore eyes. But if your ears are painful, you have an earache.
Yeah.
Why? There's no logic. I can't really explain it. I'm sorry. But it's an earache. Okay.
The leg pain.
Yeah. Leg pain. Yeah, you would probably say I have a pain. There's a pain in my leg, or leg ache. Actually, here's one for you. Here's a strange one. A symptom you may have. Does anybody know Charlie horse?
Charlie horse.
Charlie horse. On. 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 How do I say your name again? Miss Nguyen, are you there?
Charlie horse.
Charlie horse, yeah. Do you know Charlie horse, Sadat?
If I'm not wrong.
I have never.
Never seen that one?
No. I have never.
Never had that,
Never hear it.
Okay. Have you ever, for example, the day after you work out, all right, the day after you work out, you worked out too much, you exercised too much, you have sore muscles. Oh, my back is sore. Oh, my legs are sore.
Cramps.
Sometimes that's it.
Weakness.
Sometimes Charlie horse is another word for cramps. Actually, you get cramps. Yeah, my chat isn't working. You get cramps, or really hard cramps when your muscles tighten, and it's really painful, and you try to stretch it and make it go away. It's caused.
My teacher, that is mean the muscle is contraction.
Contracting, very good. Good use of English, and that is the word, exactly. Your muscles expand when you stretch them and contract when they pull together. Expand, contract. We can use those verbs in a lot of ways. We can talk, abstractly. The economy expands or contracts. Stretches apart, pulls together. Very good. Thank you, actually. Very good. Many
But
people.
it's not for lactic acid. When
Yes. Are you a doctor?
Yes, veterinarian.
What?
Veterinarian.
The animal doctors.
Ah, okay. Really? Really, Christopher? You're a veterinarian?
Yes.
All right.
Yes.
All right. Let me see if I can spell veterinarian for those in the class. And that is not right. I don't know how to spell veterinarian. Do you?
Yes.
Do you? Because I don't. I'm trying to spell it, and I know it's not right. I cannot spell it.
I can't understand you.
I'm
I don't know.
I'm trying to spell in the chat box. I'm trying to spell the word veterinarian, which is an animal doctor.
Okay.
I can't do it. My brain is frozen. Yeah. Oh, where did he go? He disappeared. Okay, but he's exactly right. It's from a lack of. It's from lactic. Not a lack of, actually, too much what is called lactic acid in your muscles. It builds up, often because we don't have enough fluids. Very common. Or
when the lactic acid in accumulation in the muscle.
Yeah, that's right. It builds up and your body isn't taking it away fast enough, and it's often lactic acid builds up because you're dehydrated. You know dehydrated? Water.
Without
the water
enough
is
water in
losing.
your body.
Exactly,
The
Frank.
water is losing.
Yeah, you don't have enough water, you can become dehydrated. So it's very important for everyone, especially in a hot
Thirsty.
place. Yeah, in a hot place or doing a lot of exercise, it's really important to make sure you stay hydrated. If you're dehydrated, you don't have enough water. Okay.
Hypovolemic shock.
Not,
I can't even say that.
not hypovolemic shock.
That
That means water losing in body.
Yeah, losing water in the body. You know, some things like alcohol and caffeine causes you to be more dehydrated. It actually does not hydrate you. Yeah, you could go into, what is it, Christopher? I mean, extreme case.
Yeah.
Very
hypovolemic shock.
Yeah, I certainly can't spell that. Okay, welcome back, Iman. Okay.
Yeah, I don't know what happened.
Yeah, Christopher too. It happens
Bad.
sometimes.
Yeah.
Okay.
Sometimes.
No worries. No worries, no worries. Okay, let me talk to a couple other people I haven't talked to, and then we're going to try a little role play. Ang, are you there? Hello? Miss Nguyen? Are you here? Okay. No answer. Sajib.
Okay, but I am here.
Hi, not you, Sadat.
Okay.
Sajib. There's another Mr. Parker. Sajib Parker here.
Yes, I'm here. How are you?
Oh, hi. How are you?
Yep, doing awesome.
Doing awesome. Okay. All right. Have you ever had a severe injury or a medical emergency you had to go to the hospital for?
Not really. I didn't get any disease yet.
Well, that's good.
Yeah.
Okay, but
So-
you never had a traumatic wound, a trauma, like a cut or a dog bite or broken bone?
No, nothing like that.
Ah, well, you're a lucky guy.
Yeah.
I've had many. Okay, but I'm sure you've been to the doctor. Sajib, have you ever gone to the doctor to be immunized? A little more vocabulary for you.
Immunized. Yeah. Yeah.
Okay.
In my childhood.
Right. Everybody, well, we should be anyway. Everyone should be immunized. What is immunized, Sajib?
You know, they give a kind of injection when I was a little baby to protect me from some diseases called I don't know how to say it in English, but 5 or 6 diseases. So
Yeah.
what is it called? I forget it.
Well, okay. Well, there's a bunch of them. The one that leaves a big mark on your arm is the smallpox vaccinate, or is that the polio? Oh, maybe I'm mixed up. But I know you need smallpox, polio,
Hepatitis
hepatitis. Thank you.
A, B,
Yeah,
and
hepatitis.
smallpox.
Smallpox. Yeah, I said that.
And Haemophilus influenza type B.
All right, those are called vaccinations. All right, anybody has babies, you need to bring your baby in for vaccinations to prevent disease later. Vaccinations, or the verb is you immunize yourself. You're preventing a later disease, right? Then there's other kinds of injections you may get. For example, I have a long list of visits to the doctors, so I feel extra qualified to talk to you about what happens in medical rooms. For example, if you're bitten by a dog or step on a nail or get cut with a tin can, you have to get a tetanus shot. Very important. I've had so many. Oh, I don't think I spelled that right. Actually, it's tetanus. Yeah,
tetanus.
It's tetanus. Yeah.
Tetanus.
Oh, yeah, I'm not spelling it right. Yeah, you're right. It's tetanus.
Tetanus.
Yeah, that's it. Okay, now I got it. Thank you.
Vaccination.
You know, even native speakers can't spell. There's 5 million words in English. I can't spell them all. But anyway, thank you. You're absolutely right. It is tetanus.
Tetanus.
Tetanus, yeah. Yeah, that's to prevent lockjaw. It's so you don't get infection. But, yeah, in the course of my lifetime, I've had, let's see, broken thumb, broken toe, 3 broken ribs, broken foot, top of my foot, and I've had, I don't know, maybe 50 stitches from various car accidents, football injuries, skiing. I bit off the end of my tongue when I was skiing. Yeah. All kinds of fun stuff. Yeah, I'm sort of a little bit of a thrill seeker. Skateboarding, broke my thumb. So I can relate, Emmanuel.
And you go to the orthopedic doctors.
Yeah, seen all kinds of doctors. Yeah, great fun.
Orthopedic doctors.
Well, all kinds. You know, I end up in the emergency room and they do what they do. Okay, we're going to have a discussion about that, but I'd like to try something for fun. I'm going to share with you a script. We're going to do a little role play. All right, one person will be the doctor and another person will be the patient. The doctor, the part of the doctor is pretty much all written, but the patient, oh, by the way, very simple vocabulary we haven't even discussed. Patient, the person going to the doctor will be the patient. And basically just have fun with it, try to read it. Hang on, I'm going to do a screen share and share this with you. Give me just a second to pull this up. Okay.
I am a doctor.
Hang on. Here, I'm doing a screen share. There you go. Hopefully you can see that. All right, going to the doctor. We'll start out, the person who is you will be the patient, all right? And basically you have a stomach ache. So who wants to be the patient? Do I have a volunteer? Volunteer patient.
Yeah, me.
Who's that? Sajib? Okay.
Yeah, because I was never been a patient.
All right, you might need to know this. Very good. All right, excellent. Maybe we'll do this a couple times. Siddharth, would you like to be the doctor?
Okay.
Okay. All right. The rest of us will just kind of listen and probably laugh. All right. So the doctor's part is pretty much done. So you can start. So basically you can start with a stomach ache, but you can say anything you want after. All right.
Okay.
All right, Siddharth. So this is you. Go ahead.
Good morning. Please have a seat here. What is the problem? What is your problem?
Thank you, doctor. I'm having a stomach ache and going to the toilet again and again.
When time is the start?
Yeah, keep going. You're doing great.
Do you have diarrhea?
Okay, diarrhea.
Diarrhea.
That's when, as Sajib says, you go to the bathroom again and again and again and again.
Yeah. I got a diarrhea because over the last 1 hour I visited the same place for like 4 times.
Okay.
Okay. Do you have any other symptoms? Symptoms?
Better. Symptoms. Yeah.
Since I'm visiting the same place again and again, I'm feeling very weak and tired, and I don't know what to do. I'm losing the appetite of taking foods. I don't know what to do. Doctor, save me.
I know. You mean you feel bad condition.
Yeah. Okay. Nauseous. Hard word. Nauseous. Nauseous.
Nauseous.
I feel so. I thought that I was I was tending to vomit, but I'm not vomiting for some unknown reason.
When did the symptoms start?
From the last night.
All right. Please take off your clothes to the waist and lie down. I am going to the examination.
Don't be, Sajib, this is very common. Don't be shocked. Just do your waist. Just be sure.
When I do this.
Oh God, is this doctor a gay? I'm just.
I am a pleasure.
Oh my. Okay.
Please apologize. Please. I apologize.
Oh, okay. Okay. Well, Sajib, it's going to be very common that you have to take off your shirt.
Okay. Let's hope it's just indigestion, but we will need to run some diagnostic tests to be sure. We'll run a blood test and we'll also need a urine sample.
You need urine sample? All right.
Urine sample.
What should it be now?
Just, from
Yes, I give you a prescription.
Prescription is what the doctor gives you a piece of paper, looks like that, and he writes on it, and you can't read what he wrote. I think this is universal in every country. Doctors have special crazy handwriting, and you can't read what they wrote. Anyway, and those are the drugs or the medicines that you will need. That's called your prescription. Okay? A prescription. Yeah. Okay. That was kind of funny. Prozac and Valium. Really?
No, you don't.
No, absolutely.
I say to Sahib.
Yeah. Okay. Well, Sajid doesn't have much experience going to the doctors, but what are 2 things we can always count on when we go to the doctors? Actually, for any of you who've been to the doctors, what is something that always happens when you go to the doctors? Can anybody tell me?
They want you to put your foot down?
Sorry? Well, one thing is, let me tell you, unless both of your arms are ripped off, you're going to wait and wait and wait. There's a reason it's called the waiting room, because they like you to wait. So you waiting room. Okay. You go to the doctors unless you have a very, very bad emergency and they need to do surgery right away. You're going to wait. Even when I injured my even when I injured my foot, I broke my foot. I cut all the tendons in my foot, so I couldn't move my foot at all. These like lines, see these lines in my hand? These are called tendons. Okay? I cut all my tendons. I actually cut the main artery into my foot. I still had to wait like 3 hours. You always have to wait. The other thing is,
fill out some applications.
It's also going to be expensive. Actually, maybe not. It depends on your healthcare system in your country. And actually, let's try this. I want to try this role play one more time. Yeah, indeed it does, Christopher. Yes. Morphine is a very strong painkiller. Actually, I had morphine when Darvon, which is equally deadly. It's a very strange thing. Has anyone here ever had surgery, actually? Has anyone had surgery? No?
What does surgery?
Surgery. Oh, okay. Thank you for asking. Surgery is when they actually cut open your body. For example, when I wounded my foot, they had to reattach the tendons to each other. So they had to cut into my foot, do more cutting, cut me open, and then suture them. Oh, a lot of vocabulary today. Suture. Okay, that's when they use a needle and thread and sew your body back together, like sewing clothes, except they're sewing your body. Yes, Christopher, that's exactly correct. I needed orthopedic surgery. So they gave me some very strong painkillers, but I still woke up in the surgery, and I was watching them cut me open, and it was like, I don't know, like watching SpongeBob cartoon. I really didn't care. It didn't bother me.
You didn't feel any pain?
Not a thing. No. Totally.
But you see, but you watch what they're doing.
Yeah, but I was watching what they were doing. And of course, normally, if I had seen that, I would have screamed like a girl and run away. Ah! Terrified, but, you know, because of the medication, I'm just like, wow, doc, that's cool. What's that? You know, just really watching what was going on. Very strange experience, actually.
You can help them.
Yeah, I was trying to help them, actually.
Oakley.
Really stupid, but yeah.
Oakley.
Yes, I'm on.
Yeah, I had surgery. I had an appendicitis.
Oh, okay. You had appendicitis?
Yeah, I had appendicitis, and they just have to open, you know, and do this surgery. The thing is that it was a very weird experience because they were trying, that was many years ago, and they were trying a new hypnotic anesthetic. And I was, when they were performing the surgery, I was conscious. I could feel the pain, but I couldn't open my mouth. I couldn't say anything. I couldn't talk. And they were like sewing, like you say. They were doing that with the staples.
Oh yeah, they use the staples now. I forgot about that.
Yeah, and I could feel the staples going clap, clap, clap. So when I woke up, I say that to the doctor. I say, listen, I was awake. I was aware of all the operation, and I was feeling really the pain. I felt the pain, and I couldn't say nothing, and I couldn't scream. It was horrible. And he says, no, you couldn't. And I say, well, I remember the staples. I know you didn't use a needle because I could feel it. And he had to shut up, you know, be quiet, because he realized that I was conscious and I could feel it.
Wow.
And it was because it was a new anesthetic that came, you know, new. It was a hypnotic kind of new anesthetic.
Yes. and ladies and gentlemen, if you don't have these kinds of experiences, these things happen. Doctors make mistakes. Doctors are humans. Hate to say it. One thing, if you go to the doctors and he says, he or she, the nurse, the male doctor, female, male nurse, whoever, if the healthcare person says to you, you're going to feel a little pressure. Yeah, right? You're going to want to scream your brains out in pain, actually. That's what that means. Let me translate doctor language. Feel a little pressure, deep, intense pain. That's what that means. Okay, so don't fall for it. Yeah, actually, I experienced very similar thing because I had interns. You know, the practicing doctors, first-year doctors are called interns, or it could be any business, all right? They may be interns. Yeah, one of my many wounds, the interns were doing it, were looking at me because the emergency room was very busy, and they were trying to give me what's called a local anesthetic. By the way, Iman mentioned anesthetic, anesthesia. That's the painkiller. Anesthesiologist is the guy, the doctor in charge of giving the pain medicine, painkiller medicine. Yeah, I had an intern, and he's just stabbing me, and he's trying to give me a local anesthetic. I cut my fingers all the way to the bone, and he's just stabbing me over and over again. It was much worse than the wound. Much worse. Much more painful. Oh, crazy.
Now exists DIS monitoring for the people that awake in surgery. It's possible. I don't know how to say. It's possible for the parameters. Darse cuenta. Think. I don't know.
Oh, conscious?
But
like actually,
yes.
Iman is the.
Yes, but the doctors
you can see that. Are you okay? I don't know this word. I don't know BIS. I don't know it. I'm not a doctor. I just let them work on me frequently. Anyway, conscious, unconscious. Is that what you're talking? Doctors can know if the patient is conscious. Oh, okay. I get it. Conscious means you're aware. Like in Amon's story, she was aware what was going on. I was aware, but I felt no pain. She was aware and she felt pain. With BIS monitor. Oh, interesting, Christopher. Thanks. Yeah. Apparently they don't. I don't know. They don't have that yet. Where Iman was, I don't know. This is relatively new.
What?
Is this a kind of a new development? A new?
Yes.
Medical technology.
Know,
okay.
5 years or 7 years, I don't know.
Oh, okay. See, Aman, you just got appendicitis too early. That's all.
Yeah, I know.
It's your fault. Okay. Actually, I want to talk about something else. We're running out of. This is a huge topic. You could talk about this for many classes. But I want to talk about something else. We're all from different countries and different places. And I've done quite a bit of traveling, and the healthcare systems are very, very different in different countries. How much, private versus public insurance, who pays for your healthcare? You or the government? Or in other words, your taxes paid to the government? Or do you have to pay everything out of your pocket? Many different things. If you have no money, will they accept you? Will they take you at the hospital? Will they actually take care of you even if you're broke? meaning broke, have no money. Is healthcare expensive in your country? Is medicine, pills, and medication, is it expensive or cheap in your country? These things are very, very controversial, and I want to give you guys a chance. Just tell me, in your own words, a minute or two. Give me, I know it's a little hard, just tell me as much as you can, maybe 2 minutes, to tell me what healthcare is like in your country. And I'm just going to go around the room. I'm going to shut up and let you guys do the talking here, okay? I'm going to start over here with Antonio. Hello, Antonio.
Hello.
I haven't talked to you yet. Where are you from?
I am from Spain.
From Spain. Oh, I've seen you before, right? So, Antonio, what is it? Tell me briefly what kind of healthcare is available in Spain. Tell me a little bit about healthcare in Spain.
About Spain? Available what?
Yeah, what is? Okay, you just joined the class, so maybe we'll finish with you. Okay, Antonio. I'm sorry.
Yes. Thank you.
All right, you can. All right, you can just listen. Arkady. Where are you from?
I'm from Russia.
Yeah, I knew that. Okay, so what is healthcare like that? Like there? Is it adequate? Is it good enough? Is it really good healthcare? Is it expensive? Is medicine expensive? Is it difficult to get healthcare? Tell me just briefly, as much as you can, about healthcare in Russia.
Okay. Healthcare in Russia is rather cheap, and the government pays for our healthcare, for our medicine disposal. But after that, to appreciate the doctor, we usually make a present to them, because because doctors, I don't know, wait a minute, I don't know how to say, payments maybe are really little. They
really
don't have much money, yes.
Wow. Okay, that is great. Now that is a great job. Arkady made a very, very interesting cultural point. Something that would never happen in America. The government pays for most everything, but it's customary to give the doctor a present after, because doctors' wages or doctors' salary, how much they're paid, is low. Wow.
Yes, yes.
Unbelievable. All right, see, that's fascinating to me. Unbelievable. In the United States, actually, who can guess, overall, average, what is the highest paying job in the United States?
Doctors, dentists maybe, yes?
No, lawyers.
Nice guess. Lawyers is number 4. Doctors is number 3.
President.
Bank presidents, bank finance officers is number 2. Average, because you have to take the average. Some banks and companies are much smaller, so not everybody is Goldman Sachs or Citibank, whatever. Number 1.
Dealers.
What? What?
Teachers.
Well, you're excuse my language, but you're damn close, Christopher. Actually, pharmacists. The highest paying job in America is pharmacist. The people that dispense or give out the drugs, that give out the prescription.
Chemistry.
Yeah.
Who making the drugs?
Not making the drugs. Actually, the people who in the drugstore sell you the drugs. They have to go to college for 6 years, get a very special license. They have to pass a test. But once they do, they average about 95, 96,000, 97. I forget.
Yeah, I know that there are people who can treat you if you have a cancer.
Mm-hmm.
They stop it because and now they selling their drugs, and it's you paying for that, and you paying for whole your life till you're gonna die. But that's why they stop the treatment of cancer.
Okay. Well, yeah, the point being that medicines are very high in some places. In some places, it's government funded. In America, drug prices, medicines are extremely high, really expensive. But now I live in the Philippines. I see the same drugs. It looks identical. It's the same pill. That in America would cost me $15 for one pill, and here it costs maybe 15 peso, which is about less than half a dollar.
Yeah, because in America, maybe 70% of people have insurance, medical insurance.
Right, and
the government paying for that.
Well, what they don't seem to realize is that, believe me, insurance in the United States, it usually comes out of your paycheck. It can be half of your pay.
I don't know it's right or not, but I heard it's not going to be in the United States a new law. Everybody going to have insurance.
Well, they're
everybody
trying.
Must have insurance.
Yeah, they're certainly trying to do that, yeah.
I don't know when going to be work, but it's going to be happening.
Yeah, I don't know. It's very, very controversial and ongoing battle. So, yeah, you're right.
But you know, it's bad. It's very, very bad. Because if you are healthy, if you don't have any problems, you're going to doctor, and doctor making you sick and saying you have the same disease to making money on you.
Ah, okay. Actually, here's, all right. You know, we can laugh. No, doctors don't make you sick. I can be skeptical, but I am and I'm not. I'm a little skeptical of what you're saying. I don't believe you, but I do believe you, Arthur, because I
can make you an example, and it's a real example.
Please,
in the United States, yeah.
Go ahead. Yeah,
I saw the 4 911 cars going and blocking the streets, and going behind of that 3 police machines, and before that coming the 2 the medical machines, and stopping for one store, and from one store they looking for one guy, one person, and he just cut his finger.
You're talking about the ambulance.
Ambulance, yeah.
Yeah, all right.
And he make him sit in that wheelchair, and they just he cut his his finger, nothing else.
Okay.
They block all street, and about 10 911 the cars come to help him.
Okay.
And for making money on it.
I understand what you're saying, and I get your point. Yes, and they do. If you have a car accident in the United States, they're going to insist that you go in the ambulance, that you go to the hospital. Even you say, I'm fine. No, I'm fine. Never mind.
Yeah.
I can just walk away. I'm okay.
And you're going to get maybe 10,000, 20,000 bills for that.
Yeah, it's insanely expensive. I agree. Actually, it's not always ethical. Here in the Philippines, for example, I have 2 daughters. So I have, they're quite young. So I've done some investigation about this. It turns out something like 46% of babies born in the Philippines are born cesarean. You know what that means?
No.
Cesarean, that's when they cut the mother open, they cut open her stomach, okay, and just take the baby out here.
It's not another
I know that.
Not natural, right?
But why? They
But
have
why?
any problems?
Because I'll tell you why. Because in the Philippines, having natural birth costs about $150. Having cesarean costs about $2,000.
But after that, she can make more children, or it's
No, she
last
can't.
one?
No, quite often women who have cesarean birth can still have children. But
every time they cutting her body.
Yeah, well, like I said, it's something like 46%. I know it's high 40s, but if you take the average in the United States, it's 4%.
Yeah.
So it's
If
not
you really
necessary.
can't, if you have some problems or
Right. It's a big emergency. So right. So what you're saying in the United States they do, believe me, in Philippines, living in a third world country, they really do. They they really
terrible.
do. Yeah, that's my opinion. Yeah. it is
Poor,
terrible.
poor girls, women.
Yeah. Anyway. All right.
In USA exists a drugstore like Walgreens.
Oh yeah. Every freaking town has a Walgreens, buddy.
Yes,
Yes.
like it's like a supermarket.
Yeah, exactly.
And the bedside in the USA, when you want to buy something, you are sick, you have a disease, you're going to the pharmacy to buy something, they wanted the paper, the doctor paper.
Yeah, you have to have a prescription. Absolutely.
Yeah.
You cannot buy almost anything except maybe aspirin,
Yeah.
headache
Only
medicine.
just, yeah, if you have a headache, yeah, maybe you can buy some
Yeah.
drugs, but
But pretty much, you're right. Pretty much everything in America, you need to have a prescription.
But
Actually,
here we don't
many
need
countries.
prescription.
Really?
In Chile, yes, I really is like I don't know how to say. The law says the prescription is obligatory, but never never. I don't know how to say.
Okay, yeah, I know. I don't.
Only controlled medicaments. I don't know, diazepam, clonazepam. That kind of medicaments obviously is with prescription. The rest of
Okay.
medicaments, no.
All right. So there are some medications that need prescription, but nobody really follows the rule. Actually, in the Philippines, in America, the reason only a licensed pharmacist can sell you medicines, drugs and medicines. They have to be completely licensed. In the Philippines, the law is that only there has to be one licensed pharmacist who works in like the big. They have like here, like Walgreens. It's the same thing. It's a big drugstore. There's big chains of drugstores here, and there only has to be one actual pharmacist. Everybody else who's running and getting your medicine and ringing you up and taking your money and all of that, they're just sales people. They're just normal people. They have absolutely no training whatsoever. So sometimes you're taking your chances getting medicine here.
I think the higher level medicine is only France.
What's that, Arthur?
I think the higher level medicine only have France and after Germany.
France and Germany?
Yeah.
Have the best healthcare system. That's
even you don't need to pay.
Yeah. Sweden
government paying instead of you.
Sweden and Norway are also very good. What's that, Emmanuel?
Can I speak?
Yes, you can. Go ahead.
Yes. I am Spanish, and in Spain,
I'm telling you, yeah.
in Spain, you are obligated to, the state retains 30% of your salary every month to pay the social security, and then all the medical assistance is free. Well, it's free. You pay it. You pay it of your salary.
And having lived in the United States and paid private insurance for many, many years, Antonio, it seems high, 30%. Actually, that seems like a pretty reasonable deal to me. It seems okay.
Yeah, but if you have money and you got some disease and you need to be in the doctor and they have any surgery on you, and you can after have a deals with them, and the court gonna be decide how much you can pay per month.
Oh,
Even
really?
if you don't have, yeah, if you even have no money, you can pay just $25 per month.
Oh, yeah. Oh, you're talking about in the United States? Yeah, you can work
Yeah.
out a payment plan.
Yeah,
Absolutely.
you can have a deal with them.
Yeah, payment plan, they call it. Yeah.
Mhm.
And they usually would prefer to do it outside of court, not involving lawyers that also cost too much money. Yeah. Anyway, this is a giant discussion, and we could discuss this all night, actually, but we can't because I have to get out of the way and make way for the next teacher and the next verbling class. Yeah.
Oakley, I have a question.
Yes.
Do you think the drugs so cheap in Filipinas are the same drug of the